Hi, everyone. My name is John Faulkner, and I'm your host of the Smarter Systems, Better Care podcast. I'm here today with Dr. Tara Scott. She is the medical director of Forum Health and a nationally recognized hormone expert. Thank you for joining us on the podcast. Yeah. And, just to give our listeners a bit of context and a backstory, how did you get here and what are you building right now?
I combined a BSMD degree in 6 years. So that was it, probably not traditional. After that, did an OB/GYN residency and really loved my OB training and doing OB. But as you guys know, with 3 small kids, it's pretty challenging. So somewhere in there, like probably around 7 years when had been in practice 7 years is when my own personal reason led me to take some time off of OB because my kids were little, we had childcare issues. And that's when I started having a lot of time with GYN patients. And that coincided that it was right around the time where the WHI came out. So I had more time to kind of look into the data. So I started studying hormone therapy because there weren't a lot of options for women at that time. I was particularly interested in hormones because I had infertility myself. My hormones were issues. And after you're kind of done with fertility, there's nothing for you until menopause. So there's this big gap in our hormone care for women. So it kind of spoke to me then. And getting back to the science and the endocrinology, I started learning. I became a certified menopause practitioner in 2006. So almost 20 years ago. And then went on. And the more you learn, you find out the less you know. So went on to do a fellowship at A4M in functional medicine and then sit for my integrative boards for my 3rd board certification, I think in 2015. So really continued to do both in my practice. I started by setting aside like a half day for hormone patients and then did my OB/GYN surgery days and call days and regular days. But it became increasingly difficult as obviously my practice grew because I was really the only person in our town doing it. And then also just it was hard to live in both worlds, where things are prescribed for symptoms rather than the cause. In 2016, I decided to kind of stop the OB/GYN. I had in 2013 opened a functional medicine practice that was physically adjacent to my GYN practice. So I could go back and forth pretty easily in the same building for a while. So I opened that in 2013. And about 4 years ago, I kind of sold that practice to Forum Health and I manage it now. So I'm the medical director of our Akron site, but it's a larger network that the benefit there is you get the HR support, the legal support, the back office support. And then I get to do, the medical side of it. So that kind of, brought me up to here, as I continued to learn more and more and more, your practice shifts. I got into the teaching world in 2010, talking to doctors, teaching them about this kind of medicine, and it's really exploded the last couple of years. So I have, I guess I beat the curve, and now I'm considered a dinosaur in the field. Just say I've been doing it for 22 years, so which is great because, I can learn from my mistakes and pass that on to other writers. So I've been teaching for a number of organizations the last 15 years.
And you spoke about this gap. Do you mind kind of explaining that a bit more with the hormones? I'm interested to hear more about that.
Yeah, so that's kind of my biggest frustration with traditional medicine is we always hear that we can't check hormones. So the word on the street, the word that's handed down, and by the way, that's not really anything that's written in a textbook or any kind of journal article. It's just like what we're told. We can't check hormones because they fluctuate too much. I haven't seen a textbook reference for that, but that's what we're taught. So when we go through our OB/GYN test a training, we have 3 months that we have to do in reproductive endocrinology and gynecology. That's where we learn all about infertility. They literally check hormones every day, right? So yes, they're checking hormones, but they're giving a hormone. They're giving a hormone to have a desired effect. So we're checking hormones during a reproductive cycle, assisted reproductive cycle. For PCOS, we're checking hormones to see what's going on. If someone stops their periods and have amenorrhea, we're checking hormones. But then any other thing, we're told we can't check hormones because they vary too much. Well, I don't know how, of course they vary during a reproductive cycle when we give drugs and for everybody else. So, in 2006, like I said, menopause care came. And then even then it was kind of poo-poo because of the hormone therapy, but now it's vogue right now. You got all kinds of people, all kinds of
Coming in.
Yeah, and like I said, the Menopause Society, is still an avenue that people can do a certification through them. So it's just exploded, but I still feel to this day that those patients that are struggling with their hormones and don't have fertility as a goal really don't have a lot of answers. So that's where I personally feel called to kind of serve that demographic, through, my goals and everything.
Yeah, that's amazing. And it sounds like you're making quite an impact and you have a lot of experience in the space. And this is more like a random question I just came up with on the moment. Have you thought about doing research and all the patients you've worked with over the years to kind of provide better evidence that that may be lacking in some areas for other physicians or other groups out there that are skeptical still?
Yeah, I actually have. And I went for a short period of time. I was the director of integrative medicine at a hospital system, our local
Hmm.
hospital system that has 6 sites. And this is before COVID. And I was super excited about an idea I had about preventing breast cancer and stratifying risks, more like a better identification of the high risk patient, and met with the research coordinator. And basically they said, well, you were hired to run the department, not to do research. So it's not in your contract. So you'd have to basically fund your own research. And this was like a retrospective chart study that I wanted to
Yeah.
do.
Yeah.
Maybe it's hard to prove correlation. So if I wanted to fund my own study, then I had another opportunity for one of the organizations that I speak with. They are connected to a company that provides the raw materials to be making hormones. So we connected a nut with a testing company. It's kind of the same thing. Unless you're going to get a drug company to sponsor you, I could do a retrospective chart review and I could look at that, if I wanted to spend my time doing that. So yeah, I did think about that several times because I have several theories, but in the end, it didn't seem worth my time to do that. I felt my time would be better served to educate other providers.
Yeah. That's excellent. It sounds like you train potentially hundreds to thousands of providers in this space, which is amazing.
Yeah.
Do you provide like one-on-one coaching or coach to groups, or what does that format look?
I did that for a little bit as well, John. I did it, and certainly during COVID and now with Zoom and everything
Yeah,
else.
exactly.
A lot of the conferences were online, and I did have kind of mentorship track where I could work one on one. And, people still reach out to me, after they hear me speak. And if it's a quick thing, it's hard to do that though, honestly, because also it got to be very time consuming, and not that it wasn't great, and it was always great helping educate people, but I think as I get older and I have less time and, you start thinking about your footprint, like, where can I make the biggest impact? So if I am one-on-one with somebody, I can help a patient. If I'm one-on-one with a provider, I can help that more patients because that one provider then can help. But if I'm one to just spoke last weekend, I think there are probably about 300 doctors in the room or providers.
Wow.
So 1 to 300, then you can affect this. I'm
Bigger
going
reach.
with 600 people, so you can just make more of a reach because, as also like this stuff, you spend a lot of time doing this. This is free stuff that you're doing, right?
Yeah.
Unpaid stuff. And it's not just about getting paid, it's about a time. So you also have to kind of balance your work-life balance as well, right? So then I think that's where I am, is like, what is going to make the biggest impact as far as like, where's my time best spent?
Yeah. And when you're looking specifically at solutions you provide to through Forum Health, would you mind kind of getting into a few of those just to kind of walk us through that for our audience?
Yeah, so at Forum Health, that's our brick and mortar site. We have a hybrid practice in the sense that a lot of people do come out of state to see us, and in our state of Ohio, we have to physically see the patient to initiate care. So then after that, so anyone will have to kind of will fly in to see us in our state. That's just Ohio's rules. And so I have 2 nurse practitioners and a physician's assistant that I've trained, that also work with me in the practice. So we all see patients and we have the brick and mortar. So with that, Forum Health has other sites. They're not all identical. They're not all specialists in hormone therapy. One sites, their providers are very big into Lyme and infection, one's good into cancer. But so I'm kind of like the person who mentors the providers within the organization for hormone questions. And we have roundtable meetings that we do once a month. And I also did some onboarding for providers there. So that's basically where I can give the one-on-one care and also kind of help with my um, nurse practitioners and PA as well.
And when you're looking kind of industry wide, kind of zooming out a little bit, if you will, like what's a shift or trend with hormones that you've seen over the years? Maybe some things have changed, maybe some things have not. So curious to get your expertise on that area.
Well, one of the things that has definitely happened since COVID is, social media has exploded.
Yeah, it's
And so
huge.
it's definitely a place for where people go for information. So, which is good and bad, because you can get some good information there. You can also get some, maybe and I'm just throwing this out there. I'm not, this is not thinking from, maybe it's someone who's a personal trainer and they went through menopause and now they have this experience. So they're giving this advice, right? And so it may be helpful. It may not be helpful. And even you have a traditional doctor telling you like, anybody who tells you to order this test, unfollow them immediately. Those kind of things. You have to wade through, well, wait a second, this doctor said to do this test. What are you talking about? So it has been helpful. Menopause has exploded. Oprah did a special on it. Gwyneth Paltrow, Halle Berry, all these famous people are talking about menopause. So there's been a lot of industries now, and I don't even remember the figure about the billion-dollar industry when you talk about menopause. So there are all these companies that are that are in the space, either to provide the products or to provide the care, like telemedicine. That's still a huge access. Access is still a problem for women to find the provider. I don't remember the statistics, but I think if you look at even just the Menopause Society, there's about, I think, 3,000 trained certified doctors. So if you do the region, that's like not every state even has a
No.
menopause provider. And then if you look at, a wider reach like functional medicine, integrative medicine, not every person that does IFM or A4M is a hormone specialist. So as I mentioned, don't ask me about Lyme and mold, that's not my specialty, right?
Yeah.
So just because I have functional training doesn't mean I'm an expert in that. So hormones are very nuanced. So, there's still a paucity of providers, but a lot of companies are coming in trying to do the telemedicine so it's available in every state, so that's
Yeah.
exciting that care is increasing. There's still a problem with access and whether or not people think you need to do testing or not. That's a difference of opinion. And then as far as the type of medications, whether they're covered by insurance, not covered by insurance. So there's still some hurdles.
Yeah. And going from the industry discussion, kind of like your own operations, what are some things that may feel so kind of like, like it moves like in a slower pace and you like to see, or maybe not progressing as you'd want? Is there anything within operations wise that you're dealing with today?
In my personal practice or just
Yeah, with patient care, patient movements, following up, all those things. It's kind of like a big question, unfortunately.
Yeah, it's funny because as I said, I opened my practice in 2013, and we've basically the protocol has been the same all the time. You do an intake, you decide what that patient needs as far as labs. Maybe it's someone that doesn't need any labs at the beginning, and you prescribe a medication, some hormones, whatever. So then they have a follow up, right? So they have a follow up to either see how are you doing on the prescriptions or what are the follow up labs, and then after that. You do the labs again before the visit. I've been doing this like this for 13 years, but it seems like patients now we're having a hard time them staying on schedule, getting your labs done. So, our schedules are so busy that we book months in advance, all four of us. And so when it comes down to you're prepping the charts and like the patient didn't get the labs done and they're like, oh, I didn't know I had to get my labs done. I'm like, we've been doing that. They sign a paper that says you're going to get your labs done. And so I don't know what the disconnect is, if it's the attention span because of the social media, everybody has a short attention span. So we're really trying to figure out like, how do we kind of partner with them because in the end, we want to serve the patients, right? But but then it's frustrating because then it takes months to get in to see me. And then the week before patients drop off my schedule because they didn't do their labs. So, we have someone prepping charts and sending messages. I have a nurse that I hired who that's above her pay grade. I mean, below her pay grade to be calling patients, telling them to get their labs done. She's there for nurse things, nurse questions, IVs, like blood draws, that kind of stuff. But she's spending a lot of time messaging patients saying, you need to get your labs drawn. They just have to be drawn. And then it takes us a couple weeks to get them. So there needs to be some planning. So that's I would say our biggest frustration in the clinic right now is we have educated. The patient comes in, they get a folder, they get all the information. They were told we're using an AI scribe, so they're literally transcribing the visit, so they have their notes they can look at, and if they get to their appointment, they're like, "What am I supposed to do?" They can go back, but they don't go back and look at their notes. So that's a little bit of a frustration, and I don't know why people were able to do this 10 years ago. I didn't have that big of a problem getting people to do their labs before. Maybe it wasn't as much of an issue because if they fell off my schedule, it wasn't as busy and they could get back on quicker.
Yeah.
Yeah, I mean, maybe I don't know. So that's what we're trying to help people, and the follow up, that the patient being willing to do that is frustrating.
And how long is like the initial appointment? Like when that new patient comes to see you, just interested to learn like what that process looks like. Also for our audience, just so they understand the process and what to expect.
We spend an hour with our new patients, and my nurse practitioner and PA. They basically all their visits are an hour, unless we are also doing some medical weight loss in our center, so some of those visits can be shorter. So we see them for an hour. We used to have a system before I connected with Forum that it was a way to deal with acquisitions and calls, that they could book a discovery call with staff, and because we are a cash practice, and I have had every business model in my practice, from insurance-based, fee-for-service, concierge, membership package, that kind of stuff. People don't, if they don't know what they're getting, they're not really that excited about plopping down the cash, right? So they get on what's called a discovery call. We can talk to what their questions are, and then we used to have a little video that sent them about our practice, right? Then the follow-up video that was the reminder call had a second video about, like, here's how our practice works. I don't know if that's still up because now that goes through Forum's acquisition funnel. So we used to have a couple of videos for them to watch, just real short. Here's what functional medicine is.
Yeah.
Here's,
Educational.
this is what we do. We do testing, blah, blah, blah. And so we don't have that as part of the patient journey right now. I try to get my nurse to follow up. In the first visit, we do full history. I generally have to have some education. Here's what hormones do. Here's where yours, I think, are. Here's what type of testing we're going to do and why. And so it's a lot. It's overwhelming to them.
A lot of
So
information.
yeah, I try to get my nurse to kind of follow up a week or two later. Hey, how you doing? And then we also have a health coach who usually it's not until after the results visit that they can do 2 calls with them. And it might be like, hey, if we recommend that you need a low carb, you're pre-diabetic, you should, really watch your diet, then the health coach can help them with what you're eating, meal plans, recipe adaptations, that kind of thing. And then we have them also do a body composition first visit and then the last visit also. So we have kind of like things along the way that they can that help them with their journey. I did have an online course too that was accessible. I think that I had to change, servers and everything. So I'm not sure that's still up for them to view. It was like about 14 short 5 to 10-minute videos about hormones and everything like that. I had filmed that as well. So we try to do that for patients, to give them that added information. But I also have all this stuff on my YouTube too. They could go to my
Yeah,
YouTube channel,
exactly.
everything, and take a look at that as well.
Yeah. Sounds like education is a really critical piece of this process, especially on intake, to educate them exactly how you're going to help them and, feel better, not just like feel better, but also like their body, you're seeing it in results that you're getting like, hey, you are improving. This is looking better. Here are the next steps. Right.
Yeah, it was really important 8 to 10 years ago because people didn't really understand what integrative and functional medicine was then.
Yeah. Yeah. And looking at your current results right now, what's working really well that you would never want to lose through this process?
I mean, the patient transformations have been amazing. I have a patient who has primary ovarian insufficiency. She never got her period. She's adopted, so she probably doesn't know a lot about a birth story. So when she was 17, 18, 19, she's never had a spontaneous period. So she's 29 now. And there's nothing for her, right? Birth control pills. Nobody understands how to manage these type of patients. And she's a patient who is very sensitive to fillers and things in different types of what's commercially available.
Yeah.
So it's been very rewarding to see her like with no hormones and depleted and not able to take anything, to just the improvement that she's had. over the last year of working with her because she needs a different approach. She's 30 and should have the hormones of a 30-year-old, right? Even though she is menopausal. So there's those patients who are not as common to help be able to help them. I like the breast. I see a lot of breast cancer patients after their treatment because they're kind of like, well, what now? What do I do? How do I prevent this? And so we work a lot with those strategies, trying to identify, what in your body kind of led to that. Is there something? Was there a hormone imbalance? Was it a toxin? What was it? So those type of patients I end up seeing a lot. The menopause patients are still great. I love to see them. But again, there's a lot of people that can see those patients. I like kind of the more unique, difficult ones that really need advanced thinking and advanced, technical things.
And it sounds like that's your bread and butter. That's where you really thrive and get a lot of passion out of it. Is maybe they've been through several providers and now they're coming to you to find a solution finally in their life.
Right.
So, yeah.
I mean, I think that's a little bit, if I'm honest, like what led me to kind of go down here because I loved doing obstetrics and I felt like I was really good at obstetrics. I was a good surgeon. I wouldn't say that was my passion and that was my forte. I didn't, once the robot came out, I never got trained on how to do that. But I was like, well, I want to be best at something. I felt like, yeah, a lot of people can deliver a baby. Not a lot of people, but a lot of people can do it and a lot of people can give great obstetric care. But I found a niche that is so desperate. Nobody's doing this. And so I think that's one of the things that attracted me personally, is to try to do the thing that wasn't being done.
Yeah. And, as you kind of work through with your patients, you're having all these successes, you're having amazing results. Where do you want to be in 6 to 12 months? What's your vision?
I got some things that I've been working on. I have done a lot of industry consulting as well, like with some of the companies that are trying to push the needle with menopause, whether it be a supplement or a telemedicine model or something like that. So I just recently partnered with a company called LifeMD to help them launch their women's health initiative, in the sense that they're trying to do telemedicine care for women's hormones. So while I won't be providing the care, I'll be kind of getting, being involved with the protocols. So that's exciting. I'm thinking about writing a book. We have a proposal. I hate to say it hasn't, we don't have a publisher yet, but really called to address that gap, right? Those people that are told they're too young to have hormone issues. That's where I want to address that in the book. So we've put together a proposal. I'm working with a health coach friend of mine who is a patient, and she's a better writer than me. So we're working together to write this. So hopefully that, you said in 12 months, I'm hoping that we have a publisher and that wants to publish it. So we're going out with that again this month. So that'll be great. I've been able to really do some additional teaching this past year, which has been great. There was a new fellowship through the University of California, Irvine. That's an integrative and functional medicine fellowship. So for physicians who are out in practice, and it's asynchronous. So it's asynchronous and most of it online. So that's really great for people who are busy office and, don't have time to go back and do the training. So that launched last year. And so I'm the head of women's health for that fellowship. So that's great. So more and more teaching, I just, to reach more people, I feel like you have to raise a village and, equip everybody to go through and become disciples, essentially. So in the next 12 months, I hope to be doing the same amount of teaching as well, if not some more. I'd like the reach on social media to be more as well for patients that are suffering, to advocate for them. I mean, that's a big thing. Educating is one thing, but advocating them, there's still a fair amount of dismissing going on of these patients, even the patients that are in menopause. I still get messages that say, my doctor told me not to take it. And so they said, well, my gynecologist doesn't believe in HRT. And I'm like, well, your gynecologist doesn't have to take it. But your
Yeah.
gynecologist shouldn't make the decision for you. You should be told of the risks and benefits and then make a decision for yourself. It's
Right.
not for everyone. I don't think 100% of people need to take hormones, but I think 100% of the people need to be evaluated and told of the risks and the benefits and alternatives. But that discussion isn't even always happening. I'm still pushing for that, in all of the social media outreach that I do for patients, to advocate for patients.
That's amazing. And where can people Connect with you, learn more? You mentioned YouTube. Is there any other channels where they can connect? And
Yeah, I'm on YouTube. It's Hormone Guru is my moniker, so Tara Scott. You can find me on TikTok, Hormone Guru. You can find me on Instagram. It's Hormone Guru MD. We have a free newsletter that comes out most Tuesdays. That's content. Love to have people sign up for that. That's on my website, Dr. Tara Scott. Also, we have a lot of free downloads. We have a free guide to hormone testing. We have a free natural therapies for antidepressants. And also, I think advocacy scripts for your doctor also. So, like I said, there's some free content, a free mini hormone course. For those that want to dive deeper, we do have a longer, deeper course for a nominal fee as well on our site. So, lots of resources, trying to do a lot of free content. Those are all reasons, subscribing to the YouTube channel and the newsletter would be great.
it was lovely speaking with you, and thank you for your time today.
Yeah, thank you.